So there's a lot that goes into the endocannabinoid system. I'm simplifying it as best I can because it can be overwhelming because it's a lot more complex system than just what you saw in that image. There's a lot of little players in the game. But what we're focusing on really are the enzymes, the receptors, and the ligands that really play a role in the endocannabinoid system itself. They do integrate with other systems throughout the body to create that homeostasis, but we're focusing just on this little piece here. So what we're looking at are G protein coupled receptors. These are things that receive the messages and the molecules from the presynaptic to the postsynaptic and then back again to kind of tell them that we're done. They are membrane bound. They can form and change result with the ligands that are binding to them to either activate or deactivate something. So they're helping with the intracellular communication. The two main receptors we talk about mostly when we're talking about endocannabinoid system is CB1 receptor and CB2 receptor. So CB1 receptors mostly live along the central nervous system. So you're going to find that mostly like along your brain stem, your brain, your spinal cord, all those areas. And they can integrate with other parts of the body as well. So even though when you think about central nervous system, you think about those main components, the brain and then your spine, it does integrate with like your lungs, your vascular system, your muscles to a certain extent. The same thing with your CB2 receptors. They're mostly found in immune cells and peripheral tissues in the body, but they also intermingle when they start to mix here and there. But these are the two main players we're looking at when we're talking about treating the endocannabinoid system. There are other receptors that also integrate with the endocannabinoid system that are constantly being discovered every single day. And we're not going to get into all those guys, but they also play a role. But these are the two main players when we're targeting and treating issues. And many tissues are known to contain both of them, so just keep that in mind. But I like to have this picture representative of that. So usually the color red is pretty associated with CB1 and blue is for CB2. So it kind of colored nicely in this little picture of this dog. And it'd be the same thing for people, the same thing for cats and such. So I made like a little diagram kind of showing you how all these little parts kind of play a role all together to kind of communicate and work with the endocannabinoid system. So you have your cannabinoid receptors that are going to receive the cannabinoid molecule onto the receptor point to receive the message. And you have your enzymes that are either going to activate or deactivate those molecules to complete it. So all these guys work together to communicate within the endocannabinoid system themselves. And when we're thinking about endocannabinoids, we're thinking about cannabinoids that are made by the body. These are called endogenous ligands. So again, if you fell down, hit your knee, you are automatically have an injury. It's going to send out a signal to start creating those ligands to come to that site to then tell the body we need to fix this, bring down this inflammation, start bringing cells over here. So they're generated on demand. So when something happens, the body says, whoop, something's going on. Let's go here. They immediately start mobilizing, start activating in the area, and they start kind of telling the body, this is what we're seeing. We're seeing inflammation, we're seeing injury. If there's a disease process going on, it's informing the body what is happening, and we need to fix it if we can. So the two main endogenous ligands that the body makes on demand is anandamide, AEA, and 2-AG. I'm not going to butcher the name of the chemical compound, but 2-AG, these are the two most common ones, and they both play a role in turning on, turning off, and completing that retrograde feedback loop to say, message received, we got it, going forward. And the enzymes that are in charge of activating, like releasing these molecules and then degrading them after they receive the message, is going to be FAAH. This is one that degrades AEA. And then for 2-AG, MLG is going to be the enzyme that breaks that one down. And to kind of help you understand everything I just talked about in terms of like enzymes, ligands, receptors, this is a nice image that I got from today's veterinary practice. It's a very simplistic representation of that very convoluted image I showed you before. So again, here you have your presynaptic neuron and your postsynaptic neuron. And then here you have your neurotransmitters kind of sitting inside this little capsule until they're ready to be released. So once those endogenous ligands are turned on, they'll release these little chemicals. They go across the synaptic gap, they attach to the receptors, and those receptors then receive the message. And then again, they kind of come over to the side, and then they release again another type of cannabinoid. So that's going to be like your 2-AG going back the other way to the top, attaching to those receptors and then being degraded, saying message received. So that's the full complete process. So the message is going to come down across, and then another message is then sent out to say, boom, we got it. Message can then stop being released. So it's kind of like the most simplistic way to kind of represent it. There's plenty of images online of the endocannabinoid system, simple like this or complex. If you want to dive in, by all means. come and join, dive into the rabbit hole. It's very fascinating.